we send a very loud and clear message to Mr. Joel Friedman. The investment banker from Los Angeles. And that message is as simple as one can imagine, and that is, do not shut down this hospital. Work with local officials, work with the unions and the people of this city, and keep this hospital open. In Hahnemann, we are talking, as all of you know, about a hospital that serves some of the most vulnerable people in this city, 2/3 of whom are people of color. We are talking about a hospital whose emergency room sees 50,000 people each and every year. Many of them, by the way, sicker than they should be because they don't get the primary health care that they need. We are talking about a hospital that employs 2,500 dedicated workers and 500 medical residents. We are talking about a hospital that has been a major part of the social fabric of Philadelphia since before the Civil War. You know, we got to be honest. And when we talk about what is proposed here, we have got to ask some very hard questions. And one of those questions is simple and straightforward. How many people will, in fact, die if this hospital is shut down? And we say human life is more important than corporate profits. Disgracefully, as all of you know, we have an infant mortality rate in this country which is much too high, and we ask, how much higher will it become if this hospital is shut down? At a time when the mortality rate for women giving birth, especially African American women, is much too high, we ask, how many more mothers will die if this hospital is shut down? As all of you know, the possible closure of Hahnemann has nothing to do with health care. It has everything to do with greed, corporate greed. It is about a national health care system in America which is dysfunctional because its goal is not to provide health care to all people as a right, but is to make as much money as possible for the insurance companies, the drug companies, and in this case, real estate speculators.
This is Bernie Sanders in Philadelphia fighting like all hell in order to prevent the closure of Hahnemann Hospital. While Sanders was giving this barn burner of a speech, trying to fight for this hospital against this kind of corporate greed, Joe Biden was releasing Biden Care, which is really just Obama 2.0, which would in fact kill upwards of 125,000 people over 10 years. Welcome to the Soapbox. My name is Jamarl Thomas. This is the Progressive Soapbox. And yeah, Bernie Sanders, given that barn burner of a speech, asking pretty straightforwardly, how many people will die if this hospital closes? And even making the point that many of the people who come to this hospital are in worse straits than they should be because they weren't getting the attention that they needed beforehand, meaning they weren't followed by a doctor. They couldn't afford it. They didn't have health care. How many people should die indeed? If you guys enjoy this content and you find yourself coming back to this channel often, please consider supporting this content through PayPal or Patreon. Even $1 helps. YouTube is an untrustworthy actor in this case. And at this point, you guys support this content. Biden care. So let's talk about Biden care. If this was released 10 years ago, this would be amazing. But this is not 10 years ago. We are in a new world. And the fact of the matter is healthcare and the cost of healthcare is the number one issue that came up when people were asked, what are the things that you care about? What are the things that plaguing you? What are the things that concern you? Healthcare was number one. Biden finally gets to the point of releasing his healthcare plan. So let's take a look at Biden care. One thing I want to say about Biden care, Biden accepts that there will be 3% of the population that wouldn't have healthcare. Understand what we're saying here. Let's stop pretending that people not having health care, people living on the street, are acts of God. Those are not acts of God. Those are acts of public policy. Politicians, people who put in laws and rules and regulations, they make those particular conditions that allow certain things to take place. Joe Biden is predicting that there will be 3% of the population without health care. Now, Biden is also saying, trust him this time. He's hugging Obama on this. Now, the first time around, Obama came, when he got into office, Obama said, public option. When he got into office, he scuttled it. Biden said, no, you can trust me now. You can trust me now. You can trust me now. 3% without health care. He's choosing that 3% without health care. You don't have to have that choice. He's making that choice to have 3%. And going by 3%, which is a low estimate, by the way, when the CBO made an estimate on the number of people who signed up for Obamacare, it was wrong. Only half that number signed up. Meaning, if Biden is predicting 3%, it will likely be more than that 3%. But give him the benefit of the doubt. Even go by 3%. Estimates show that that means within 10 years, there'll be 125,000 people dying without health care. Again, not for an act of God, but for an act of policy. A policy that Joe Biden is choosing. He doesn't have to choose this. The other three candidates in the race at least given lip service to Medicare for all. And even beyond that point, many of the candidates talk about universal health care. Biden makes no allusions to that. 3%. 3%. That's amazing. Choice. This is his choice. Let's take a look at the article itself. And by the way, it's not just me. And I have a few points that I want to hit on this, but let's go for the basics. Joe Biden's released the healthcare plan today. Its most significant elements are 1, the creation of a public option, 2, the increase of subsidies for those buying plans with exchanges, especially for families and incomes above 400% of the poverty line, and 3, the option for individuals in non-Medicaid expansion states to enroll in the public option for free. Biden claims that the resulting system will ensure 97% of Americans, meaning 3%, will remain uninsured. My question is, why are you leaving the 3% uninsured? You don't have to do that. You're choosing to do that. So right here, the most remarkable thing about Biden's plan is that it doesn't even aim to provide universal health care coverage. The more moderate wing of the Democratic Party has mostly been putting out plans that purport to achieve universal coverage through auto-enrollment mechanisms without national health insurance. But Biden is literally doubling down on preserving Obamacare by preserving the class of uninsured people. It's acceptable to him to have a group of people in the country that don't have health care insurance. This is a man who had a son with cancer, and who uses the fact that his son having cancer is why you have to act on this immediately. You have to do this now. You have to do this now. What about the people with that 3%? Should they not get health care? Do that 3% not include people with cancer? Do you not care about those people? I mean, come on. 3%. That's amazing. I want to talk about this further, but let's go further. His campaign claims that the plan will leave around 3% of Americans uninsured. These sort of estimates should be taken with a grain of salt, as it's very uncertain how people will respond to reforms. For instance, the CBO initially estimated that 22 million Americans will sign up for the insurance on the Obamacare exchanges, but only half actually did. Even if you suppose Biden's estimate is right, the uninsurance rate goes to 3%.
About which was the issue.
The uninsurance rate goes to 3%. That still implies an enormous amount of unnecessary death caused by a lack of insurance. One commonly used estimate states that one unnecessary death occurs annually for every 830 uninsured people. This means that during the first 10 years of Biden care, over 125,000 unnecessary deaths will occur from uninsurance. And that's under his plan. I mean, that's under the best view of Joe Biden's plan. And it's no reason to believe that it's going to be the best view. No reason to believe it's going to be the best view. A few points. One, the Biden's plan to give 100 to 25,000 people. We talked about that part too. It's a lift either way. So Biden and Sanders have been fighting on this very point of Medicare for all, and these attacks have been getting pretty strident and pretty, going back and forth at one another. Politico comes out with a piece. Now, Politico is not a left-wing organization at all. It's a pretty centrist article. Look at this, though. Building on the ACA is the quickest way to get more people insured and affordability while not taking on any powerful healthcare industry group or disrupting coverage for those already who have it, said Larry Levitt. I guess that's a plus while not taking on the industry. Fair enough. Larry Levitt, Executive Vice President for the Healthcare Policy for the Kaiser Family Foundation. But incremental improvements to the ACA would leave an inefficient and costly healthcare system in place. Levitt added, preserving high prices and high deductibles for roughly 160 million Americans with employer-based coverage. But Biden is doubling down on this. Biden is standing on this point of, look, I'm not going to even try to cover the entirety of the country. I am willing to leave 3% of the population because we don't have a minute to waste. We don't have a minute to waste. We got to do it now. We got to do it now. That's been his argument. We got to do it now. We got to do it now. And going further, saying we shouldn't get rid of what's in place, meaning we should just incrementally improve upon Obamacare. But the point of healthcare is not improving upon Obamacare. The point of healthcare is healthcare. And you guys got into office, you passed Obamacare, making that big lift, leaving 30 million people uninsured in the process of doing that big lift. We're still talking about healthcare today. And you're hugging Obama, screaming, let me do it again. Let me get another crack at the apple. Here's my point. Why does Biden believe that the lift for his Obamacare 2.0 will be any easier or any significantly easier than the lift for Obamacare? For Medicare for all. I said that poorly. Let me say that again. Why does Joe Biden believe, or his campaign team believe, that the lift for Biden 2.0, Bidencare, or Obamacare 2.0 will be significantly easier than the lift for Medicare for all? And I accept that the lift for Medicare for all won't necessarily be the easiest thing in the world, but why does Biden believe that the changes that he wants to put into place, that the healthcare industry will be all that lovely, meaning would love it? Because I would disabuse him of that in the same difficulty it would be for getting Medicare for all through Congress, it will be almost as difficult for getting his plan through. I hope you understand my point. It's a lift either way. Joe Biden is making it as if his plan is going to be significantly easier to get through Congress as opposed to Medicare for all. It is not. And if you're going to go through that, do it right. Why are you going to go and make that heavy lift again? We're talking about healthcare again. Why are you going to make that heavy lift again and still leave 3% of the population uninsured? That makes zero sense to me. That makes zero sense to me. And again, it's not something that needs to be in place. It's not an act of God. It's an act of Joe Biden, meaning the policy that Joe Biden is going to accept. Just like Obama accepted a policy that left millions uninsured. We're still talking about healthcare. We're still talking about healthcare. We're 8 years out? We're still talking about healthcare after that extraordinarily heavy lift for Obamacare. Leave. Joe Biden says, give me another bite at the apple. I'm saying, why give Joe Biden a bite at the apple at all if Joe Biden is making the argument that he's going to leave an underclass of people that are going to be uninsured when that is not necessary? Even the other corporate Democrats, at the very least, give lip service to this notion of universal coverage. Joe Biden makes no such illusions. And, and the sad part is, they still don't go for it. They still don't go for it. But even Democrats' incrementalist approaches face deep opposition from a well-funded health industry opposed to expanding government-backed health insurance. Even Biden's plan, which is my point, why does he believe his Obama 2.0, that incremental plan that doesn't cover everybody, will make it through any easier? And the point that the article is making is it would not be significantly easier. My point is, if you're going to do it right. You're going to have to take the industry on either way, take them on wholeheartedly. Third point. Politically, so let's talk about the politics. Joe Biden is taking a political gamble in the same way that Bernie Sanders is taking a political gamble. Joe Biden is making an assumption that the public will go for incrementalist approaches, and that I suspect polling that he's using believes that you can pick Medicare for all apart. And by picking it apart, you can make a political argument that reaches the public in a way that says, well, yeah, that sounds sensible. We could just expand upon what we got, as opposed to doing a Medicare for all plan and fixing it and doing it right. It's a poll-tested response. Now, the fact that it's poll-tested also allows him to hit the other three Democrats in the race, meaning Kamala Harris, Bernie Sanders, and Elizabeth Warren are the three candidates that are closest to catching Joe Biden. Joe Biden has been falling in the polls for the last several weeks. I mean, he's lost like 9 points even after the debate with Kamala Harris taking a chunk out of him. So Joe Biden has staked his stake in this degree of centrism. Nobody on this planet is going to believe Joe Biden is a progressive, so he doesn't have any airs about it. He says, I'm going to take a centrist approach to healthcare. I'm going to take a centrist approach to climate. I'm going to be the centrist president. And he's running on this notion of electability as getting him from point A to point B from an electorate that actually wants something that's more progressive, that may be a little bit, let's say, shy and going for it. Electability only goes so far. I would say that to Joe Biden. I would say this, though. He's staking his claim in this. If you can burn Medicare for all, if you can put a knife in it, if you can make it seem impractical and plausible, something that can't happen, can't take place, they mean well, but they're just wrong. But they do mean well. They're just wrong. Healthcare is an emergency. We got to do something right away. We don't have time for Medicare for all. We just got to expand Obamacare. We don't have time to start something new. That's the argument. And that argument is punching this notion of trying to put a hole in people who are going for Medicare for all. It just so happened to be his last three competitors. If he can burn Medicare for all, if he can make it seem impractical, implausible, impossible, then he can also put a knife in the campaigns of Elizabeth Warren, Bernie Sanders, and Kamala Harris. It's politics to some degree. It's politics. Not to mention, you can't hug Obama and then go against Obamacare. His hugging Obama and the way that he's doing, meaning Biden is running on his time as vice president with Obama, meaning it's kind of difficult to put a knife in Obamacare if that's what you're doing. So he goes with, I'm expanding Obamacare 2.0. That's the way he goes with it. Now, Biden often brings up his son in this, which is kind of nasty politics. The reason why I say it's kind of nasty politics is you can't hit a man with a son with cancer, but I am going to hit a man with a son with cancer. Biden's plan is going to leave several people, hundreds of thousands, that will die because of it. Some of those people will have cancer. Some of those people will be ill. And by the way, just because you have health care doesn't necessarily meaning just because you have insurance doesn't necessarily mean you're off the hook. My mom, barely making ends meet, wasn't necessarily all that endowed financially. Her son gets sick. And then medical bill after medical bill after medical bill. And when you go to the hospital, you get a bill from all of those doctors, including the hospital itself. Meaning, just because you have health care doesn't necessarily mean you're not going to be eaten alive with bills. Joe Biden's point about his son having cancer and making that to this notion of Obamacare 2.0 misses the point that having health insurance is not the end-all be-all. A Medicare for All plan would get rid of those bills that the individuals will have on the front end, and those things will be paid on the back end through taxes, as opposed to having people eaten alive with bills. Joe Biden's plan doesn't deal with that. That's kind of my point. It's one thing to have a health insurance plan that covers everybody, and that person doesn't have to deal with bills eating them alive on the front end, as opposed to Biden's plan, which essentially keeps those health insurance companies in effect, and having those people, even by Political's article, keeps those high prices instantiated. You may get some price reductions. Do not misunderstand me from the standpoint of having the healthcare, having the public option. But the people are still going to be eaten alive with bills and still be eaten alive with drug bills. Medicare for All, if he really cares, meaning if his son having cancer really digs in him, in the same way that John McCain being tortured dug in him, where John McCain was against any form of torture despite being okay with bombing everybody else. If they really dug into him, a Medicare for All plan would be the plan to ensure that people were covered the best. Just saying. I mean, if you're going to bring that up, let's talk about it. Also, this other point, this notion that Medicare for All is somehow starting over. That is one of the most ludicrous points, I think, in this whole thing. Biden made this point or brought this up as if people were going to lose their health care insurance. Again, this was also nonsense. The transition to Medicare for All supposedly would take like 4 years. In that transition, the people do not lose their health care insurance at all. Those people are still able to see their doctors. Here's another point. Medicare for All, Medicare already exists. So it's not starting over. Expanding Medicare is not the same thing as starting over. There's a difference in those things. 80% of the population enjoys their Medicare. You have people who scream, get your goddamn hands off my Medicare, your government hands off my Medicare, not knowing that the Medicare is a government program. They love it. Expanding it to the rest of the population is not the same thing as people losing access to their doctors. That's my point. And the other point, every year that I worked in my company, we changed insurance. Every year. The company was always looking for a cheaper insurance plan, which meant that our insurance plan changed year after year after year after year. My wife, same thing. Her plans change year after year after year after year. Every company that I've been at, they've looked over, whether I was in New York or whether I was in Virginia, they were looking for cheaper insurance to offer their employees. Medicare for All is stability. Understand what I'm saying? Medicare for All is stability. You don't change your plans over and over again. You see the doctor that you want to see. It's like, it's not the situation where you're losing coverage or losing access to healthcare or your doctor or anything else. Medicare for All is literally the opposite of those things. What Joe Biden wants, for the most part, continues the same broken and dysfunctional healthcare system that we currently have in place right now. And it's so bad when he's saying that he's okay with 125,000 people dying as a result of a plan that he is putting into place. Again, he doesn't have to do it. It's not an act of God. It's an act of policy that Joe Biden is trying to push through. Not to mention, there's this weird point that he's thinking that they're going to be okay with his plan any more than they are with Medicare for All. They will not be. My last point in this is pointed to lefties. I know sometimes we look at this stuff and we get annoyed by them putting knives or attacking certain plans. And Joe Biden is running in a Democratic Party and a Democratic electorate where the overwhelming majority are for Medicare for All. Joe Biden is getting by on this notion of electability and because of his name recognition, but that only goes so far. the majority of the population in regards to the Democratic Party is for Medicare for all. The majority of the population as a whole is for Medicare for all. Joe Biden, however, is running on this notion that he can pick apart pieces of this by focusing on elements of it that the public may dislike, if that makes sense. It's like he's running against this, but this allows him to run against the other candidates. My point is this: electability only goes so far, and it's a gamble. For lefties, we get annoyed at this, but in this case, don't. Joe Biden is making a bet. Our job is to call his bet, and in calling his bet, we push through a door that has been locked for God knows how long. This also creates a situation where it's clarified the one-on-one aspect of the race between Sanders and Biden, because Sanders is the most strident proponent of Medicare for all, and Biden has set himself as being against it. So the press looks at this and says, all right, these two forces are going at one another. We have Clinton and Sanders all over again, and we can run this as a narrative. And so they're running it. So from my standpoint, don't hate this fight. This is the fight that you need to win anyway. We have an interregnum. There's a changeover in the standpoint of who's leading the party, the established wing or the Sanders wing. The arguments that are being put forth in the Democratic debates were clearly in a world of Sanders. Clearly, anybody who's watching that debate. My point is this. If you're trying to get anything accomplished and you really want that better world and you believe that better world is possible, sometimes there is a deficit of imagination because people have been beaten down so much in regards to the political life. Biden is a dinosaur that is going with this notion that we can't have nice things. We can't think big and do big things. In the same way they passed Medicare and Social Security and the Civil Rights Movement and the Voting Rights Act. They passed all of these big achievements the same way we put a person on the moon. We are beyond doing big things. And we have Joe Biden to remind us that we are beyond doing big things. I don't believe that. I think the public may get a little, encrusted and rusty for some of that stuff. But I think if the argument is made to him and the fight is taken on, then that fight and that argument can be won. For the longest time, they said, oh, people don't want taxes raised on the rich. And then all of a sudden, AOC says something about it, and the public says, yes, we do like that. And when they say, oh, no, they would never go for Medicare for all. And then you have the majority of the public saying, yeah, we are for a government healthcare system. My point is this. This is a fight that you're going to have to take. And this is a fight where you're going to have to establish that there is a new order. There's a new person in charge. And not person in charge, but there's a new philosophy. There's a hegemonic shift in ideas. The Overton window has changed over to a point where this is the standard now. But you're not going to be given that. That has to be taken. And the person that has to be taken from is one Mr. Joe Biden putting out this centrist argument, screaming with his shirt off of centrism for life. He's clarified the position. Our job is to win it. This is a grab your musket time. This is one of those times when you run out of your house, you run into the streets, and you push and scream hard with this notion of Medicare for all. There are times where we believe that our points of view are not being listened to, or that nobody hears us, that we're in our own little bubble, our own little sandbox. But think about the conversation that we're having right now. We're talking about Medicare for all, and the argument of Medicare for all being somewhat of a litmus test, and Joe Biden making a fight on whether or not Medicare for all will be the thing that supersedes from the primary into the general election. A few years ago, Medicare for all, you couldn't even get a public option to be talked about. When Obama ran, he talked about the public option, and he got in office, and they got rid of it immediately. Don't believe that your voices are being heard. The world that we're in now, the arguments that are being had now, are based on us and the things that we've been screaming and pushing and yelling about. Healthcare is the top of the list on the agenda, and the job is to take down Joe Biden's argument. So I'm going to end this here. I don't want to. Oh God, this one has gone 30 minutes. But yeah, I end this here. All right, guys. If you enjoyed the content, please feel free to share, like, subscribe. You can always support through PayPal or Patreon. Thanks all.